Hello and welcome to a new episode of our podcast, EuroHealth. My name is Jan Klusacek and our guest today is Professor Peter Piot, who is special advisor to the President of the European Commission on the response to the coronavirus and COVID-19, and as well Chief Scientific Advisor for Epidemics in the EU. Welcome, Professor.
Well, pleasure to be with you.
I must start with the big question that everyone is asking these days. When will the pandemic end?
Well, I'm sorry I forgot my crystal ball at home, but although I'm at home. But I think that it is, of course, a very important question also because, frankly, we're all fed up with this epidemic and with all the restrictions and so on. And so we all wish we could go back to to normal or go to the new normal. I would say that there is room for optimism now, and but it's not. It's impossible to fully predict the future. But I would say that my rather optimistic side of my brain tells me that the current Omicron wave, which is still quite heavy peaking, and certainly in Central Europe and moving more eastward. But if we look at the experience from the UK and from Denmark, then and now also Belgium, the peak is gone, is over. So we probably will see the same pattern. So that I think we can safely say that as of, let's say, the end of March, so probably things will be much quieter. And that we can be relatively optimistic for the spring and the summer. After that, honestly, nobody can tell because it'll depend on a few things. In the first place, whether a new variant will come up, and that could also come earlier. But and there is now also already talk about so-called BA2 that's been documented in Denmark, but it seems that it's not creating a really huge outbreak. But what I think will probably happen is then when the next winter comes, getting colder, we spend more time inside, that we will see a new increase in cases caused by, is it Omicron, is it something else? So in short, I don't see the end of the epidemic close, but I see much better times, and certainly for the summer. So that is the hope we all have. But it's the virus who decides also. If the virus comes up with a new a new form that escapes our immunity, our vaccination status, then we can be again in trouble. But I have good hope. And it also probably means that we can relax many measures, but we should probably keep some baseline. Personally, for example, if I am in public transport or so, I will always wear a mask. I had it myself. I'm also over 70, so more vulnerable. And that we are ready in a predictable way if cases go up again, that some measures can be put in place. But if vaccination continues, and particularly with boosters, we should go for a relatively, better summer, better spring. But we've been wrong before.
Mm-hmm. Well, you've mentioned something really important, the new normal. How do you imagine it will look like, the new normal? Do you think that there will still have to be some measures implemented, let's say, forever? Or is it solely on an individual basis that when someone is feeling not well, or when someone is above some age level, people will still be more careful?
Yeah, very good question. And let me start with something different. But when I went to Japan for the first time, it was in 1981. And I saw people in the street with white masks, not that many, but there were. And I thought, maybe these are people who are, let's say, paranoid about microbes and microphobes and so on. And then I asked, and the Japanese said, no. This is here. When you have a dripping nose, you're a cold, or you don't feel well, you wear a mask to not infect the others. And that is not imposed by the government or whatever. It's now part of culture. And that started about 100 years ago with the Spanish flu. And so that's an example of, let's say, what could be a new normal. It is, in this case, it's very altruistic. It's to not infect your fellow citizens. And in Japan, if you are, let's say, you have a bit of a cold or dripping nose and you are not wearing that, culturally, that is certainly not acceptable. It is like if you would light up a cigarette in the entrance hall of a hospital here. These before was no problem, but now these. So social norms may change, and I think also maybe there may be less handshaking and so on. So that could be, but I think that it will be largely indeed individual assessment of risk, and I would say, for example, okay, my parents are both dead now, but if I would still have older parents, and I would go and visit them, I would take a test in the morning and to see that I don't put them at risk. Or so these things may become part of the new normal. I think there's another aspect, not so much to do with health behavior, and that is that with COVID, we've seen that you can do a lot of work from home. And not everyone, of course. If you're working in a hospital or in manufacturing, you're the fire brigade or the police, okay, you have to be in the street, you have to be in the, in the workplace, of course. But many, particularly in service, sectors and others, you can do from home. And I think that's going to last, not completely, of course, like it has been, but personally, I never thought that was an option. I mean, it was just not in my head. When you have a job, you go to your office, you go to your workplace, and you do your job there. And so that, I think, is going to change quite a bit the habits. Also, the fact that there has been a boom of delivery at home in many, many countries because of COVID. It seems that that's going to continue, and so on. So there will be all kinds of things that we will probably, in our collective memory, will say before and after COVID. Like when my parents were talking, was before and after the war. There is some kind of a collective milestone. But we also need to have a system for predictable measures. In other words, the government, but the citizens also, they need to know when the situation requires measures. And that I think is something that every country now should set up. And it depends, but it would, for me, the main parameters are how many people are hospitalized, end up in intensive care and are dying. Not so much how many people become infected, because with Omicron, we've seen that the majority are just mild infection or nothing at all. But if you see a big increase in cases in intensive care, for example, then you have to be, oh, wait a minute. Now we need to do whatever, mask wearing or avoiding crowds. I think of the 3 C's. It's crowds, closed spaces, and being close to someone. But for me, we should by now have learned that it is more or less predictable, and that because for many people have the impression that it's what we say in my mother tongue is yo-yo. You just one day the government says this, and then the other day something else, and then they go back. and so on. And in the beginning, I totally understand that because nobody knew, had not been confronted with it. But now we need something that is more predictable. Also for businesses, they need to know when can people come to work and so on.
What about vaccination as a part of new normal? Do you expect that we'll need to get boosters every year, or will there be some new kind of vaccine that will be just like once every 5 years or 10 years or something like that?
Yeah, very, very important question. And of course, I always say, just imagine we would have this Omicron wave without high vaccination rates. The hospitals would be full, and we're seeing it in some countries in Europe. Bulgaria, Romania, where the hospitals are overwhelmed because they have very low vaccination rates. We see it in the United States, because in the US, some states have very good vaccination rates, like in most European countries, and others very low. In the US, it's very political, this issue.
Blue and red states.
Yes. Oh, yes. And and it's in the ones with very low vaccination rates that we see huge mortality and so on. So I'm saying that because sometimes I wonder, have we made any progress? But then I was thinking, okay, think where we were a year ago. So things have improved. So then coming back to your question, that is that we need continue to be vaccinated. That's sure. But I think that for those of us who have had a full vaccination with a booster, that the protection against serious disease, against ending up in intensive care and dying is very good. How long this will last, nobody knows. How long this protection lasts. And also, it's clear that we need a next generation of vaccines. As you alluded to, an ideal vaccine for me is like for measles. You get it as a child, one shot, and you're protected for the rest of your life. That's what we need. But is this possible for coronaviruses? Nobody knows. And so we need...
Measles, measles don't have so many variants, is it right? Full Greek alphabet.
Yes, exactly. So this coronavirus change. It's like influenza. The flu vaccine also has to change every year. So there is, on the one hand, research that is started now for a vaccine that is going to protect against all the variants, present and future. Who knows what they will be? So looking for some conserved part of the virus and that we, have immunity against, and that would protect us. Two, that with longer lasting protection. And three, that could also protect against infection. And that probably means that, for example, we need protection at the level of the nose and the mouth. At the moment, the vaccines are really good against serious disease, but they rapidly become ineffective against becoming infected. And that's research. So from where I am as advisor to the president of the European Commission, so one of my points is that while we're dealing with the current wave, and that's going, I think, relatively well, we need to think of the winter, the next winter and autumn. And I would say that most likely, certainly people who are the elderly, who are immunocompromised and have major problems like diabetes and, very obese, they will probably need a boost, an injection before the winter. And I would say, like myself, I got a COVID vaccine in my left arm and influenza in my right arm. Okay, maybe that's the way we're going. Whether this will be necessary for the whole population, it's a bit early to say. And I think we can go to a system where we're either, with the current vaccines, we have an annual vaccination, but I hope that we will come with vaccines that it may be ideally only once in your life, no longer, or every 5 years and so on. And this is where we need more intensive research, and that's what, for example, in the EU has established now HERA, the Health Emergency Response Authority, and one of the missions is to invest in vaccines that are going to protect us against everything. So that's one of the jobs, and of course in many countries, and also have some antivirals, drugs, and I know Czech Republic has a very illustrious history of developing antiviral, discovering. You are very strong in chemistry and biochemistry, so I'm looking also at you for new, for new drugs.
Well, not me personally, but I believe we have pretty good scientists who can look on that. But let's circle back to you personally. You are Chief Scientific Advisor for epidemics and pandemics. What does it actually mean?
Well, it means that I'm collecting up-to-date information, scientific information on the epidemic. For example, early signs that there is a new variant, for example, and what does it mean? So in order to do that, I need to be in touch with laboratories, with scientists and epidemiologists all over Europe and all over the world, because, for example, the Omicron that was first detected in South Africa. But personally, I've worked myself in several places in Europe, but also in the US, in Asia, in several places, in South Africa. So I have these connections. And then secondly, I chair, together with Commissioner Stella Kyriakides, the health commissioner, every 2 weeks and sometimes every week, a platform of the national COVID coordinators of every single member state of the EU. And people report. And this is very important to know before it's in the media, before it's published and so on. So people present the latest, and we learn from each other. And then I'm trying to help the European Commission and some member states to formulate the whatever policies. But I fully understand that there is scientific advice, but then politician has to take into account many other elements, and so to make sure that they can take in decisions in the best informed way possible.
Okay, you mentioned working with scientific information, and well, you have lifelong experience with dealing with scientific information. But for, let's say, average EU citizen, it's not so simple to find a way around what is actually scientific and what is not. Everyone would prefer to just have some scientific fact like the Earth is a globe, and okay, it's not flat, then it's done, and we are sure about that. But it's not the same when it comes to COVID. Actually, it's just the other way around. The information and the scientific information, even from respectable sources, are changing quite often. Once it is like, okay, this vaccination is the end. We actually had a campaign that the vaccination is a full stop of the pandemic, and obviously it's not like that. Former Minister of Health in the Czech Republic said that well, once you are vaccinated with two doses, 2 jabs, you are in virtually zero risk to be infected, which we know is not like that these days. So, how should average citizen deal with this situation?
This is a fundamental question, because trust of the citizens in not only the government but in the science is really key. And one of the biggest challenges for this epidemic has been how to manage uncertainty. It's much better than, let's say, than 2 years ago. We had no idea. I mean, in the beginning, I I knew that this was bad because for many years I gave a speech, and the title was in English, "Are we ready for the next pandemic?" Because I've been working on Ebola virus, on various epidemics, on HIV and so on. So, and I was convinced there will be an epidemic. But then when the reality hits, it's very challenging. And so particularly, politicians had to take decisions on the basis of not much information. So that takes, I would not have liked to be in their position. And many of these measures were very unpopular for understandable reasons. So that's one point. And then secondly, for vaccination, first I thought it would take at least 2 years to develop a vaccine, and I was certain, I'm not sure that we will be able to have one, because I've worked a lot of my life on HIV, and HIV/AIDS was discovered in 1981. So more than 40 years later, we still don't have a vaccine. And it's so complicated, and it's not because there was no investment. Billions have been invested.
It's actually the other way around. Then with COVID, for COVID we have vaccine, but no sure treatment, and let's say stabilizing treatment.
For HIV we have very good point. And so, but then when the vaccine came, I was also very enthusiastic, and I was, like many, was probably too optimistic. Not probably, definitely too optimistic, because the clinical trials showed very good protection, over 90% and so on. So very good. But then, particularly when this Delta wave came, this a new variant of SARS-CoV-2, as the virus is called, then it showed that vaccination is one. The duration of protection is limited. It doesn't protect. So we were clearly too optimistic. But now I would say the following: without vaccination, there is no way we can bring it under control. So it is really saving probably millions of lives in the end. So that is a given. However, it's not enough. It's not enough, and hence, vaccination. And we needed a boost. And I would argue now that you need 3 injections to have the full vaccination. And I hope, and that exists for some other vaccines, for example, against hepatitis B. So it's not new. And for the elderly people, they in general react not as well to vaccines. I mean, they react well to no side effects, but the protection is not so good, because our immune system, when we're getting very old, it goes down. So we need a combination of measures, and I still hope that one day we'll have the perfect vaccine.
Okay, let's hope so.
Yes.
Well, you mentioned something that I fully agree with. Then I actually wrote it in some commentary in a newspaper that the COVID crisis in Czech Republic was mostly a crisis of trust in the government, and trust that the government actually does the best for the population. And do you have any comparison on reaction of respective governments in the EU, how they reacted, and what measures were actually the best, and what didn't work? Because in Czech Republic, we had really strict measures. We had our schools were closed for a very long time. Our restaurants were closed for a very long time, and still we have one of the worst statistics concerning death in the whole EU. So why did it happen?
Yes, well, I don't think we have a clear answer. But first of all, trust is so important. Look at vaccination. There's in most countries, the overwhelming majority of adults are vaccinated and accepted it. But there is vaccine, let's call it diplomatic hesitancy, or people who are absolutely against vaccination. Whereas I think it's absolutely normal and I think healthy in democracy that you ask questions. Okay, this vaccine was developed in 10 months. Is it okay? Didn't they take shortcuts and so on? So this is valid. I have no problem with that. But then you have people who are dead against it because they don't want the state to control their lives. They think there's a conspiracy that Bill Gates put a chip in your body to control you, etc. I mean, from reasonable to completely absurd things. And then sometimes it's purely political. And that is particularly in the US, but some bit in Europe as well. And we've seen also, I was on in a meeting of this platform, and we hear from like the Nordic countries. There is high trust in government in general. Nothing to do with the COVID, but in general. When the government says something, they don't have to be, people do it. And for example, now Denmark and Norway and Sweden and Finland, they are relaxing the measures, but people are asked to behave, and they do. In other parts of Europe, that's not the case. And a lot of it has historic grounds, a mistrust of government because governments have, misbehaved. So I can understand that. And then we have another issue, and that is, for example, Spain and Italy were very badly hit in the beginning. Italy, the first country. Well, they're now among the best ones in in Europe. Germany did very well in the beginning, and now also has relatively lower vaccination rates and problems. So I think we need to look at this this is not a medical issue as far as I'm concerned. It is an issue more in scientific terms of political science and social science and how people collectively react. We see these big demonstrations in some countries. In Brussels, we have riots. Mm-hmm. But I think your point is that trust is absolutely fundamental, not only for COVID, but it will also be very important for many other things. Think of climate change. We have climate change. We will need a lot of measures, not just for 2 or 3 years, or 3 years like for COVID, but for a generation. Very unpleasant, maybe expensive how to do. And then there's the whole trust in the political system, of course. But I think that's one of the fundamental issues for democracy and for for Europe and for each member state, not only for health. Absolutely.
Well, do you think that one of the reasons why there is this mistrust might be that the response for COVID was based merely on scientific information from healthcare scientists and not from or medical scientists and not from people with expertise in sociology, psychology, etc. Maybe lawyers even.
Since I spend a lot of my life, professional life, working on HIV, and there we've always had a strong collaboration between the medical scientists, the social scientists, political, but also the people themselves. When in May 2020, I came out to say so. I published and I gave interviews because I had been in the hospital, I had long COVID and so on. That was not to promote myself, but to the fact that I was very unhappy with the information about COVID. It was all about statistics, flattening the curve, saving. I was then living in London, in England, and then maybe as an afterthought about people and that people die. And I got really upset about that because I had been in the hospital and with oxygen and pretty bad off. And I said, this is about people. And I was convinced that this would go on for quite a while. So then you need to listen to people. I mean, I think communicators, people who are in the media, traditional, new media, and big and small, whatever local level, they should be really involved in this, in developing the policies, not to do what some politicians do and just follow the opinion polls. No, but if you don't know what the opinion polls say, what people live, and that can be unpleasant for whoever is in science but you need to know, and it has to be, I think, also more granular. I mean, the average opinion at the level of a nation, that's interesting to know, but that's not. It's made up of. We have different subcultures in every country, and in the capital they think differently from in a rural area, etc. And a 20-year-old and an 80-year-old, etc., etc. So men and women. So I've always been a big advocate for what we call in our scientific jargon the multidisciplinary approach, and where the social sciences have a very big place. When I was the director of the London School of Hygiene and Tropical Medicine until July last year, we strengthened enormously, social sciences, because if you can have the best vaccine in the world, but if people don't want it or don't, it's not going to work. It's not going to protect. And of course, I'm a bit biased because my wife is an anthropologist, so I'm a communication person. So yeah. I'm kind of get that message at home. But I was convinced of that before we met anyway.
Great. So, do you think that the Austrian approach with vaccination mandates is something that could be an inspiration for other countries? Or does it actually make sense to start mandatory vaccination or to require vaccination at the end of the last wave before the summer? That should, as you mentioned, should be quieter.
Last week we had a debate in Belgian Parliament. It was the Commission on Subcommittee on Health, and had hearings. I think about 30 people, and basically, with some exceptions from some medical organizations, the conclusion was that it was not recommended to have a generalized compulsory vaccination, where there is a great majority of people think that healthcare workers, people who work in homes for the elderly, they should be vaccinated because they are exposing the most vulnerable in society to risks. I mean, if you deal with cancer patients, even if vaccines are not 100%, you need to do everything you can to diminish the risk. That is the duty of a doctor, of a nurse, and so on. So that was concerned. But for the general mandate for the whole population, here was not so much support, also because the vaccination rate is very high. So what are you going to gain? Not that much. And it's very divisive, and it's a bit late. The vaccine is not perfect. So here, no support. It may be in countries where there's very low vaccination rate. Maybe that's it could be, debated. Let's not forget there's compulsory vaccination for polio in many countries. That's still there, but for children in Italy and France, they have, and some others have compulsory vaccination for a lot of childhood diseases. So I'm not against it, but I think you need to know what are you gaining. And in which context, and I think at least there needs to be a healthy debate. So I don't know enough about Austria to make a judgment. I'm not diplomatic, but I think that it depends. And then also, it's done. So what are you gonna achieve? There is a financial fine, you have to pay something, but are you going to really force people to get the shot and so on? So how do you do that? But so I really think, coming back to what you raised before, is that we need to listen to people. We need to investigate how can we do better. And I think what we can do on a voluntary basis is better. And for that, if we know that in a particular group in society, age group, or a particular area, or religious, whatever it is, then we can concentrate our efforts and work with them, because in general, most people are pretty reasonable and can be convinced. But if it's imposed, some will say absolutely not. But it's not going to be possible, I think, in Europe to have one uniform policy for that. Also, because we are our history. If one thing in Europe is we all have baggage, history, and that makes Europe so wonderful, and diverse, but also complicated. Yeah.
Well, you are working for the president of the European Commission. So what is it exactly that the European Commission can do in the area of pandemic response? We know that healthcare is mostly the responsibility of the member states. So what is it that we can hope EC to help member states with?
Indeed. Health is not a legal competency of the European Union. And I think there's a good reason that, for example, healthcare is not something that you can handle at a European level. Every country has specific systems and ground in history very often, like Germany, it goes back to Bismarck. However, viruses don't know borders and don't need a visa or a passport. And so there, I think for epidemics in the future, we need some European coherence and action possibilities. And let me give a few examples. I think a real success has been the procurement of vaccines for all the member states. And I think coming from a small country, Belgium, that's very appreciated, because smaller countries would have been at the end of the queue for buying vaccines. So that brought some equality in there. Secondly, there is a digital certificate and a vaccine certificate that's valid all over Europe. I was recently in the United States, and that's one sovereign country, because the EU is not one country; it's a union. In the US, there is not one certificate. Every state has a different one, sometimes even within one state, and it's a complete mess to know if someone has a valid vaccination or not. So that has been there. And then something different about the freedom of circulation of goods. In the early days of the epidemic, several countries closed the borders.
Oh, yeah. Czech Republic as well, unfortunately.
Yes, indeed. Yeah, and also some countries banned the export of diagnostics or of protective material and so on. And if every country starts doing that, this is not a matter of ideology, so we're very practical, then we're all suffering, because our economies are so integrated. And that was, I think, resolved thanks to action at the EU level by creating so-called green corridors and so on. So that's, and now I think the fact that COVID was discussed at the European Council level, at the level of the prime ministers, I think that's also important, that they could show, because this is a matter of leadership. But also, now looking to the future, is that we need to be better prepared. That's why HERA was established, the Health Emergency Research Authority, so that there is an instrument which we didn't have, and that there are also regular information sharing, because knowing early in an epidemic is very important. But it's not enough to know it, but also to share this with your neighbors, with others, and that doesn't always happen. So that's another area where a health union could make a difference. for everybody.
And what could European Union do to prevent further pandemic of this scale on the global level? Is it about better communication with other countries where it could start, better information sharing? Is it about better support of poor countries with limited access to vaccines and tests, etc.?
It's all of the above, in the sense that, first of all, you need to know. So early information within the EU, so we have to share in that information, and that has not always happened, but I think with this epidemic has gotten better. We also have European Centers for Disease Control, which has to be stronger to do that. But then also, an epidemic and a new virus can come from anywhere in the world. It can come from within Europe. One variant came from England, okay, no longer member of EU, but still, geographical Europe. Yeah.
So-called Bojo variant, right?
Yes. Yeah, and or come from Asia or Africa, Latin America, whatever. So we need to have that knowledge, and that's managed very rapidly. Also, one of the things that the European Commission has done is invest and support countries to start so-called sequencing of viruses. So genetic sequencing, because most countries actually in the Union did not have much capacity for that. That has greatly improved thanks to massive support from the EU, and that has to continue, because that's how we will know whether there is a new funny or nasty variant or mutant that pops up and early on. We also need to look beyond us. First of all, in Europe, what they call in the bureaucratic jargon, political jargon, the neighborhood. I mean, our neighbors in the Balkans, for example, etc., on our eastern borders, southern borders. We are not an island that's completely, isolated.
And we are not New Zealand, right? That could isolate itself very easily.
Exactly. So we need to support vaccination efforts and even within the Union have stronger public health institutions, but also in Africa, because the problem is not over until it's over everywhere. And so having that at the same time is important. And then support research for example, better vaccines, for vaccines that are against what we call pathogen X, the unknown. You can say, how can you do that? Well, you can work on it and be better prepared. Because if we had these vaccines so rapidly, it's not because they suddenly were produced or they didn't fall out of the sky. It's based on decades of basic research, and so we need to do that. So there's a lot to do, and I hope that it will not slip off the agenda when the pandemic is no longer headline news, because it's in so-called peacetime, in quiet time, that we have to prepare. One of the big problems that we had was manufacturing of enough vaccines, and so we need what they call warm facilities that can be ready when we need them.
What was the one most important lesson learned from the last 2 years, from your point of view?
I think that nothing can replace leadership, and but leadership that is also informed by science and is and informed by people and has trust. I think that is probably for me the most important thing, because you can say, okay, most important is that we have vaccines, and as a scientist I love to think that, but a vaccine without that leadership and without the trust would not have saved so many lives, and so that's for me probably the most important one.
Okay, thank you so much for your time. Thank you for coming here, and I hope it's not the last time we see each other.
No.
So thank you. Have a good day.
Pleasure. Thank you so much, and thank you for doing this.